Insulin is a hormone that is released in our body by an organ known as the pancreas. The primary function of insulin is to help regulate our blood sugar levels. That is, whenever we eat food that contains calories, there is a signal to the pancreas to release insulin. This insulin acts on various cells in our body to help bring the blood sugar levels down. Now, how does insulin do this? Insulin acts on receptors present on cells. These receptors act as locks. Whenever an insulin molecule attaches to these insulin receptors, it opens these locks. When these locks are opened, sugar or glucose is able to enter into cells. This glucose or sugar is utilized by our bodies to give us energy. Now, how exactly does insulin resistance develop? If you are consuming a diet which is very high in calories, there is a probability that your insulin will continuously be high. This persistently high insulin levels will cause damage to your insulin receptors. It will also signal to your cells, telling it that do not respond to this high level of insulin. When this happens, your blood sugar levels will slowly start increasing. This rise in blood sugar levels is known as prediabetes. If prediabetes is left unchecked, it will progress to diabetes. It is important to understand why do you develop insulin resistance. There are certain risk factors which put you at a predisposition or risk for development of insulin resistance. These include being overweight, having a diet which is very high in carbohydrates or refined foods, if you have a family history of diabetes, and if you are consuming certain medications such as corticosteroids, you are at a high risk for development of insulin resistance. We need to catch insulin resistance at an early stage so that we can stop it from progressing to prediabetes, diabetes, and a number of metabolic diseases.